It starts quietly, almost innocently. A missed period here, a little extra hair there, a stubborn acne breakout that refuses to heal. A woman looks into the mirror and feels something changing inside her body, but she doesn't know the name. Not yet. Days pass, then months. The changes become louder. Weight gain that doesn't listen to diets, hair falling more than before, mood swings that feel like a terrifying roller coaster. Panic begins to rise inside her, because her body is no longer behaving like her body. And one day, the doctor finally says the word that flips her world: PCOS, polycystic ovarian syndrome. She smiles weakly, pretending she understands, but inside her heart, fear hits like thunder. Fear about health, fear about hormones, fear about her future. And the most frightening fear of all, will I ever be able to become a mother? That one question becomes a silent shadow following her everywhere. I am Dr. Ayurmoolam, and today we are entering the emotional and medical depth of PCOS, a hormonal disorder that impacts nearly 1 out of every 5 women in reproductive age, but most continue suffering in silence. They blame themselves for gaining weight. They hide their face because acne attacks their confidence. They avoid social events because relatives constantly ask, "When will you give us the good news?" The world doesn't understand that behind their smile is a war with their own hormones, a war with their own thoughts, a war against judgment and shame. PCOS is not just a physical condition, it is a psychological thriller hiding in the body, slowly disturbing dreams and destroying peace. It challenges fertility, confidence, mental stability, and emotional health. And that is why this topic is not just important, it is urgent. The symptoms begin like scattered puzzle pieces: irregular periods, sometimes too long, sometimes absent for months. Sudden weight gain that sticks like glue. Thick, dark hair growing on chin, chest, or abdomen. A shocking attack on femininity. Severe acne, hair thinning, oily scalp, mood swings, anxiety, emotional breakdowns, cravings, fatigue, unexplained sadness. Some women cry in washrooms after seeing another negative pregnancy test. Some hide behind makeup to mask their pain. Some pretend they are strong, but inside they crumble with every insensitive question about their fertility. In the clinic, doctors see enlarged ovaries with many immature follicles, small cyst-like structures. Ultrasound becomes the first clue of the hidden enemy. The root cause is deeper than appearance. Medically, PCOS happens when the body produces too many male-type hormones, androgens. This hormonal chaos stops the ovaries from releasing eggs regularly, leading to infertility. Insulin resistance, another villain, pushes the body toward weight gain and eventually diabetes. Lipid imbalance enhances the risk of heart problems. Ayurveda explains that disturbed vata disrupts the normal movement of blood and hormones, while kapha increases weight and cyst formation. Stress inflames pitta, causing anger, heat, and acne. When all 3 doshas lose balance, the reproductive system becomes a battlefield. PCOS is not a single disease, it is a hormonal storm. Women often visit doctors only when trying to conceive, but by then, PCOS is already damaging mental health. Many experience guilt. Why my body? Shame. Why do I look like this? Fear. What if motherhood is not in my fate? Emotional wounds bleed deeper than physical symptoms. Anxiety becomes constant. Depression becomes a silent roommate. Social pressure becomes torture. Every festival, every family gathering, every casual conversation turns into a reminder of what they cannot achieve yet. This emotional pain can drive them away from loved ones, from dreams, from hope. Understanding this emotional burden is the first step of healing. Diagnosis should be scientific, not guesswork. Ultrasound confirms the presence of multiple follicles. Blood tests reveal hormone imbalance, elevated testosterone, LH-FSH ratio disturbances, thyroid and prolactin issues. Insulin tests expose metabolic risks. Mental health screening becomes equally crucial because the mind absorbs more suffering than the body ever shows. Doctors must listen with empathy. Women must speak without fear. Delay in diagnosis leads to delayed dreams. Treatment needs a multi-layered plan because PCOS is a puzzle made of many pieces. The first and strongest medicine is a balanced diet. Food becomes a powerful weapon against insulin resistance. Women with PCOS must choose nutrition that supports metabolic health. Real, whole, unprocessed food. Proteins from lentils, eggs, milk. Healthy fats from nuts and seeds. Fiber from vegetables and fruits. Avoiding sugary foods prevents spikes that otherwise encourage the body to store fat, like a curse. Hydration calms inflammation. Timing of meals balances hormones. Physical movement awakens hormonal balance. Exercise improves insulin sensitivity, promotes ovulation, enhances mood, and burns stubborn fat. Brisk walking, yoga, strength training, each session becomes a gift to the body. PCOS isn't cured in a day, but every step makes ovaries stronger. Sleep, often ignored, fixes half the hormonal imbalance. A restless mind creates a restless body. Quality sleep stabilizes stress hormones and supports healing inside ovaries. Sometimes medicines are required, and that is not failure. Metformin supports insulin control. Ovulation-inducing medicines help those trying for pregnancy. Vitamin D improves hormonal balance. But trust only a qualified doctor, not random advice from the internet. Ayurveda brings natural support. Ashwagandha controls stress and emotional trauma. Shatavari nourishes reproductive tissues. Cinnamon helps sugar metabolism. But all must be advised carefully, respecting individual conditions. Managing medicines must be empowering, never confusing. Lifestyle decisions determine whether PCOS becomes a friend or a lifelong enemy. Stress management can literally bring periods back on track. Meditation calms anxieties that kill ovulation. Screen control helps sleep. Removing negativity from life protects mental health. Self-love isn't luxury, it's a treatment. Women must understand, my body is not broken, it is asking for care. Emotional health is not separate from reproductive health. They walk together. Long-term prevention rests on 3 pillars: balance, patience, and consistency. Small routines done daily save women from giant hormonal storms. A walk every morning, a plate filled with color instead of junk, drinking water instead of sweetened drinks, choosing kindness over criticism, laughing more, sleeping early, and speaking up whenever the heart feels heavy. Infertility fears do not define a woman's worth. Motherhood is beautiful, but so is womanhood itself. PCOS tries to steal confidence, but with the right knowledge, women take their power back. If this video helped you understand PCOS from a new perspective, then share it with every woman who needs support, not judgment. Support this mission by hitting the like button and subscribing to this channel for more medically accurate, emotionally supportive, women-focused health content. I am Dr. Ayurmoolam, and I will continue standing with women who are fighting their silent war. No woman deserves to cry alone. No woman deserves to suffer without answers. Let knowledge become your strength. Let hope become your medicine. And let love, for your body, your mind, and your future, become your healing.